Hello, this is Dr. David Green, CEO of the Texas Pain Network. Today's topic is what you need to know about whiplash. Whiplash is a hyperextension and flexion injury to the neck where one's head suddenly moves backward and then forward due to a sudden shift in direction. The extreme motions push the neck muscles and the ligaments beyond their normal range of motion, causing injury. So you see the normal alignment here, then the hyperflexion, the hyperextension. That leads to whiplash. Most commonly, whiplash occurs from a rear-end automobile accident. That's by far and away the number one cause. Other motor vehicle accidents, sports injuries, amusement park rides, slips, trips, various falls can lead to whiplash, and then assaults. There's about 3 million cases per year of whiplash in the U.S. It occurs more often in women than men. It's actually thought to be due to the difference in anatomy between a woman's neck versus a man's. The symptoms of whiplash are going to vary. It may include neck pain, muscle stiffness and spasms around the neck, headaches, possibly some dizziness. Patients may have blurred vision and fatigue, maybe some memory problems and irritability, and difficulty concentrating and sleeping. There is a high association between whiplash and concussion. It's unclear why whiplash leads to the symptoms that it does. It looks like there's ligament damage in the front and back of the spine. In addition, there's studies showing there's some damage to the facet joints of the neck because of the range of motion that it goes beyond the normal. This can cause post-traumatic arthritis along with chronic neck pain. Treatments for whiplash as far as medications include nonsteroidal anti-inflammatories, Tylenol, opiate medications, muscle relaxers, possibly some topical prescription pain medication as well. Bracing can be very helpful for short-term pain relief, physical therapy, chiropractic treatment, acupuncture. Spinal decompression therapy is shown to be an excellent treatment for whiplash. When you start looking at interventional treatments, facet blocks can be very helpful because remember there is some damage to the facet joints. Trigger point injections can be very helpful for the spasms and the aching. Medial branch blocks can help with facet pain relief. And then radiofrequency ablation if it turns into chronic pain. The interventional treatments, facet injections place steroid medication directly into the facet joints and numbing medicine. Okay, this steroid can stick around and provide pain relief for weeks to months. Trigger point injections can also help with the spasms as mentioned. Here's a radiofrequency ablation. This is in the lumbar spine, so disregard the fact that it's not showing the neck. It's the same, really. Here's a catheter that goes around the joint, and it can deaden these little nerve endings that provide sensation to the joint. It's the same thing in the neck. It just deadens these. They're called medial branches. And that can provide pain relief for anywhere from 6 months to 18 months. Typically, the prognosis is very positive for whiplash. Head and neck pain typically resolves within 3 months. 15% of those with neck pain from whiplash end up with chronic pain. And with the non-operative pain treatments mentioned, that can lessen the 15% number and decrease the time frame in which a person feels pain and symptoms. The top non-operative pain management for whiplash is in the Texas Pain Network. There are several affiliated clinics throughout the state providing accepting over 50 insurances and providing over 25 treatment options with the board-certified award-winning doctors. Visit us today at texaspainnetwork.net and then call us for more information and scheduling at 877-877-8556. I'm Dr. David Green with the Texas Pain Network. Your pain stops here.